for your product and also archiving, what does 2.0, 3.0 look like?
I mean, 2.0 really is this Cures Act compliance. So, what our product is, and we're almost there. What we're focused on doing is, the Smart on Fire launch, which is now you're able to seamlessly launch from the EMR with essentially the same privileges as in the EMR as well. So who's launching, who the user is, and they may not have the privileges to see that patient, for instance. So that setup is coming from Smart on Fire. Then we're actually persisting our data as fire resources, and in our contracts we're writing that at no cost to the customer, we're gonna if you divorce for whatever reason, we're going to give you the data as essentially fire resources. So it's sort of highly interoperable way of giving the data back to the customer. And then we run a full read-only fire server. So which essentially means that an organization that is going live with, say, Cerner or Epic, they're essentially a duopoly now, and they just have 5 years of data in there. They can seamlessly, and this is work in progress, we can deliver the fire resources, but we want in our 2.0 that they are able to come through my chart essentially, and the patient's going to be able to ask, or an application on their behalf they can allow them to get access to the legacy data, and we'll deliver it to the application in a fire native format. So the last bit, I would say that is version 2.0. We're not quite there as yet, but we're almost there. So even today we run a full capability fire server, but making that last mile of how that data actually gets to the patient without their having to get another ID password, integrating that with my chart for Epic, I think that is the next version for us.
Actually, I really like that. That's a great self-service, because they're bypassing HIM. You have anybody who has a MyChart account can now request not only see the data from the current EHR, but also see any legacy data that was 4 or 5 years old without calling medical records or patient relations or whoever it might be. So good move.
Exactly. And that's very exciting for a vendor like us, I think. And we're thankful, frankly, to the United States of, adopting the fire standard and pushing the big vendors, the Epic and the Cerner. And so they're developing their app orchards and code.cerner.com. And that really is good for the, end customer. There's the patient essentially. So I think this is going a long way towards interoperability in healthcare, which has been lacking over the years. But we feel like, the next, 5 years, we're just going to see an explosion of, innovative products that really help the patient.